Welcome to Pandemics and Pestilence. I'm Dr. Jeff Ryan. This course was designed as an elective in the Emergency Management undergraduate program. It also counts as a general elective in many of our other undergraduate programs, and it is open to graduate students and JSU alumni alike. This is the first content lecture for EM 307. In it, I will cover the burden of infectious disease. This is certainly a topic that we can all relate to now, given the fact that COVID-19 has become a household term and nearly everyone on the planet has been affected by it. Hosea Ballou was a clergyman and author in the early 1800s. He said that disease is the retribution of outraged nature. These were very prophetic words uttered some 200 years ago. We live in a world today where our planet is stressed by overpopulation, pollution, and deforestation. Ecosystems are threatened by mankind's manipulative actions. We tend to get the sense that Mother Nature seems to be lashing back at us. Climate change, drought, floods, and then, seemingly out of nowhere, a global pandemic from an emerging infectious disease threatens the world population. This lecture has one overarching learning objective that is supported by 5 enabling objectives. Following this lecture, you'll be able to identify the perils and burden associated with infectious diseases. In order for you to be able to do that, I feel you will need to be able to describe the immediate effects of infectious diseases. You should also be able to list the different types of infectious agents that cause them. From here, we will cover the different routes of entry that enable these agents to enter the body and the different ways that diseases are transmitted. Finally, we discuss immunity and the countermeasures we use to fight infectious diseases at the individual and community level. When a person becomes infected with a pathogen, sometimes there is no outward effect. The person feels fine. Their immune system rids the body of the infection. However, when that person is immunologically naive to that organism, there is likely to be morbidity or illness. This can lead to death or mortality. Morbidity is defined as the condition of being diseased. You have signs and you have symptoms. A sign is something that can be seen or measured, such as a rash or fever. A symptom is something unseen that has to be described by the patient. A headache, body aches are examples of this. On an individual level, morbidity will lead to lost workdays, lost wages, malaise or feeling bad, tired, wasting away of the individual, or a failure to thrive in infants. And then, of course, repeated episodes of fever, chills, and body aches. Infected, chronically ill individuals living in a setting where there is a poor health infrastructure may remain ill for very long periods. If this is widespread through the community, that community will be impacted by the burden of infectious disease. When I consider this scenario, I often recall my work in small villages in the Rift Valley of Kenya. The burden of malaria, waterborne illnesses, and leishmaniasis was overwhelming for those people. Here are the 5 broad types of infectious disease agents: prions, viruses, bacteria, fungi, and complex parasites like protozoa and cestodes. I will now cover each individually. A prion is an infectious protein. It's not an organism at all. Rather, prions are misfolded proteins with the ability to transmit their misfolded shape onto normal variants of the same protein. Here's an example shown here: Creutzfeldt-Jakob disease, which was first discovered in cannibals. Those that eat the flesh and the brain matter of other individuals led to this very strange disease, which is also called kuru. This was first observed in pygmy tribes in Papua New Guinea. Other prion diseases that you may be more familiar with are mad cow disease in bovine, chronic wasting disease in deer, and scrappy in sheep. Viruses are not cellular organisms. Rather, they are simple pathogens that invade host cells. Basically, a virus is genetic material packaged inside a protein coat or capsid. Viruses do not metabolize nutrients like cells do. There is no cellular respiration. Instead, they attach to a host cell, invade it, replicate, repackage themselves, and kill the cell. One invading virus particle, called a virion, may result in hundreds or thousands of progeny, which ultimately leads to the cell bursting open and releasing those virus particles. Let's look at this simple diagram to get a sense for the process of viral invasion and replication. Referring to the diagram, we have a virus which attaches to the host cell. Because of this attachment, it can gain entry inside the host cell. Once inside the host cell, the capsid breaks down and the genetic particles, either RNA or DNA, invade the nucleus of the cell, where they take over the machinery of the cell, repackage themselves as virus particles, and then cause the cell to burst. And the process repeats itself over and over again. Here are some common viral diseases. Influenza, or as you like to say, the flu, coronavirus, like COVID-19 and SARS, adenovirus, measles, mumps, rubella, chickenpox, and hepatitis. Many of you have had one or more of these. Most of the United States population has been immunized for measles, mumps, rubella, and chickenpox. Some viral diseases can be treated with antiviral drugs. An example of this is how influenza, or the flu, can be prevented and treated with the antiviral drug Tamiflu. Bacteria are single-cell organisms that metabolize nutrients. They are living beings. Much larger than a virus particle or virion, they come in many shapes and sizes. Here are some of the most common shapes known for bacteria: spheres, or COCCI, rods, or BACILLI, and spiral-shaped, or spirochetes. Shown here are some common bacterial diseases: strep throat, staphylococcus infection of the skin, food poisoning from salmonella, and E. coli. Also, many sexually transmitted diseases are caused by bacteria. Bacterial diseases can be treated with antibiotics like penicillin, ampicillin, and azithromycin. Fungi are single-cell organisms higher up on the evolutionary chain and more complex than bacteria. Seen here is a condition of the mouth and throat known as thrush. It is also called candidiasis, which is caused by the fungal pathogen Candida albicans. Here the fungus overgrows the tissues inside the buccal cavity. Some other common fungal diseases that you may have heard of are aspergillosis, blastomycosis, athlete's foot, and ringworm. Parasitic diseases are caused by protozoa and worms, or cestodes. They are the most complex infectious agents that we have to deal with. Due to their complexity, it has been very difficult to develop vaccines for these agents, and they are often treated with substances that are also toxic to the patient. Here you see an image of a guinea worm being extracted from the foot of a child. Below that is dog heartworm from a post-mortem procedure on a canine. Next to that is the organism Trypanosoma cruzi, which is the causative agent of Chagas disease. And last, above that, is the nasal passage of a man with mucocutaneous leishmaniasis. There are three primary ways that infectious agents get into the body: through ingestion, or eating and drinking; through injection, a break in the skin by something sharp, or an insect bite; through inhalation, breathing in air that's contaminated with airborne particles or respiratory droplets from other infected people. Note that infectious agents are not absorbed through the skin. The skin is a protective barrier to all the infectious agents. Now let's look at how infectious diseases are transmitted. In general transmission, or to the left of this slide, this can occur from contact with your environment. Waterborne transmission is a possibility. Also, insect and tick-borne diseases are part of this general grouping. Human-to-human transmission, which is on the right side of this slide, can occur in many different ways. Direct contact through handshaking, hugging, and other forms of affection is an example. Infected persons may deposit germs on surfaces for others to pick up. Respiratory droplets and airborne transmission may also occur. And finally, there's the fecal-oral route. A person infected with a pathogen that passes through their stool will leave behind germs when they don't wash their hands or when they contaminate restroom facilities. Secondary infection occurs when these germs pass to the hands or mouth of another person and they ingest those germs. Here are several specific examples to demonstrate the many ways that disease transmission occurs. The first example is malaria, which is transmitted through the bite of an infected Anopheline mosquito. Malaria has been a tremendous burden for human populations. It still kills more than 500,000 people per year. Most of the cases occur in the tropical and equatorial regions of the world. Africa is particularly hard hit by malaria. The age group where mortality is the highest is 5 years old and under. Let's start this cycle of transmission with an infected mosquito. First, we'll start here. An infected mosquito bites a human. The pathogen is transmitted through the saliva of the mosquito. It enters a blood stage here. The red blood cell that's infected migrates to the liver. The liver becomes infected, and the liver erupts with red blood cells that are still infected. They begin to circulate through the body. At this time, the patient becomes ill. And then an uninfected mosquito can come by and have the second blood meal on that same person, but now this time they are actually infecting the next mosquito, and the cycle repeats itself over and over again. There have been several serious outbreaks for Ebola virus disease over the past 10 years. This has killed thousands of people. Infected individuals shed millions of Ebola virus particles in their bodily fluids: tears, saliva, blood, urine, etc. People who care for the sick or bury the dead acquire the virus through touching contaminated surfaces, and then they themselves become infected. Contaminated objects are known as fomites. We consider the primary means of transmission of Ebola as direct contact, like you see here on the left side of this slide. But we also know that fomites play an important role here. Distance from the infected person, disinfection, sanitation, and personal protection are very important when caring for Ebola patients. In previous outbreaks, caregivers ended up as the largest percentage of patients by far. Next, we move on to cholera. Cholera is a terrible scourge. This is true in poorly developed countries, and especially those that are affected by recent catastrophic events like a hurricane, flood, or earthquake. There have been 7 major cholera pandemics over the past few hundred years. The primary means of transmission is fecal-oral. This diagram here shows how it can be transmitted from left to right. Here, we start with a cholera patient who defecates in an unsanitary setting. The cholera bacteria are on his hands, deposited on the soil, and may even end up in the community's water supply. Flies also pick up the germ from their feeding and egg-laying habits. The germs are transmitted to other people in the village because sanitation conditions are so poor. Remedies to this are hand-washing facilities, properly designed and placed toilets, water disinfection, and water distribution systems, and of course, education. The next example we have here is smallpox, which spreads from human to human through airborne transmission and fomites, or virions deposit on objects that contaminate other people. Smallpox was one of the most feared diseases in our history. It was one of the most highly transmissible diseases also. Approximately 1/3 of the people that contracted it died from smallpox. If you got it, there was a very good chance that you would be scarred for life. When Europeans first came to the Americas, they brought this scourge with them. Native populations had not been exposed to this previously, so there was no immunity to it within the entire population. Through their contact with these explorers, they contracted smallpox and they suffered greatly. Have a look at the image on the right. This photo shows two boys. The one to the right was immunized and the one to his left was not. Surely this will give you an immediate appreciation for the effort that managed to eradicate this disease from the planet through the global administration of a safe and effective vaccine. The eradication of smallpox in 1980 is one of the greatest triumphs in public health history. Finally, we have COVID-19, which is caused by SARS-CoV-2, a novel coronavirus that made its appearance on the world stage in early 2020. The COVID-19 pandemic has affected us all in some way or another. Perhaps you, a friend, and or a family member have contracted COVID-19 and were made ill by it. You may have lost your job. As a minimum, you have been greatly inconvenienced by it due to social distancing, masking, and the closure of some businesses and the curtailment of some social events. COVID-19 is primarily spread through respiratory droplets. To a lesser degree, it is also spread through indirect contact, fomites, and aerosol transmission of small particles, called droplet nuclei. There are many things we don't know about it still. However, 3 things we can all do to lessen the spread of COVID-19 is wear a face mask, maintain your social distance, and practice good hand hygiene. Often when describing the status of a particular disease, we use some terminology that needs further explanation. Let's look at 3 very important terms: endemic, epidemic, and pandemic. I'll define each one for you. Endemic is when we find a disease regularly among people or in a certain area. So, given this example to the far left here, we see North America, Central America, and South America, and the prevalence of a particular disease found throughout both continents. Epidemic is when we find a disease that is widespread in a specific community or a locale at a particular time. Here we see an image of the South American continent for an epidemic of some disease that is broken out there in those countries that are in the northwestern part of that continent. Finally, we have pandemic when a disease is prevalent over many continents or the entire world, very much like we have with COVID-19. In public health and the medical profession, we attempt to control diseases using a number of measures. Obviously, good hygiene and sanitation are important for healthy people and communities. Education is another tool that we use. In fact, it's the very reason why this course was developed in the first place. Information will make you better able to cope with the stress of a pandemic and hopefully modify your behavior in a way that you remain healthy. Surveillance is really important. We use diagnostic tools and surveillance programs to track the presence and incidence of disease. This could be a whole lecture in itself. Suffice it to say that you can't solve a problem if you can't identify it. And testing is of paramount importance to the individual and the community in that regard. Prophylaxis, or vaccines, or preventative medicines have been developed to help individuals acquire immunity to an infectious disease. Vaccines have saved hundreds of millions of lives and greatly limited the burden of disease. I'm a huge fan of vaccines. And finally, here's the treatment with specific drugs. I've already given some specific examples of those, either antiviral or antibiotic. Let's cover the three primary ways our immune system protects us from infectious disease. The first that you can see here over on the left of this image is barrier immunity. This is what our skin is designed for. It's a protective layer that keeps pathogens out. We also have mucus production and coughing as a mechanism to help us trap and expel organisms that seek to infect us. And finally, there's the acidity of the mucous membranes that help to keep us free from infection of the urinary tract. In the middle here, we have innate immunity. This is something that occurs when an infectious agent gets into a break in the skin. The body reacts with a swelling and an on-site reaction. Pus is formed, which is dead white blood cells that have engulfed the infectious agent and have eliminated it. And finally, to the far right here, we have adaptive immunity. This is a subject of study in and of itself. The immune system reacts to the presence of a foreign body or a pathogen in a number of intricate and complex ways. Antibodies are created to attack that pathogen, and in most cases, the immune system programs itself to rapidly react to any reinfection. This comes as a result of natural infection and through the use of a vaccine. So no doubt, you've heard a lot of things in the media about infectious diseases lately. An outbreak or pandemic is big news. But hey, it's not all doom and gloom, folks. The fields of medicine and public health have given us many positive developments through infectious disease research. 150 years ago, we didn't even know what caused infectious diseases. We have something now called germ theory that shows us the way to find which pathogen causes which disease. We have public health programs that have come about over the last 120 years. We have chlorine, which has been used to disinfect our water supplies, a very important lesson we learned from cholera. We also have antibiotics, which were discovered in the early 20th century, and vaccines that were produced subsequent to that. Smallpox has been eradicated from the planet, and soon polio may be the next infectious disease to be eliminated. We're getting very close with that. All of this has led to a downtrend in the crude death rate from infectious diseases that you can see here with this diagram. Starting in 1900 to the year 2000, what we see here is a steady decline from 800 deaths per million to as few as 50. But wait, we have also suffered some setbacks over the years. As I said in the beginning of this lecture, man has manipulated his environment. Overpopulation, especially in large metropolitan areas, contribute to the spread of infectious diseases. We are all interconnected through international travel and commerce. As man cuts into the natural environment and exploits its resources, we encounter newly emerging infectious diseases. Most are zoonotic diseases, defined as a disease that affects another animal as well as man. We are also putting evolutionary pressure on these pathogens through the increased use and abuse of antimicrobial drugs. This has led to multiple drug resistance in many pathogens, bacteria in particular. These things have become huge modern-day challenges. Nature is amazingly complex. We will need our best minds to conquer these problems. In conclusion, you now know what a burden infectious diseases have placed on mankind. They will continue to be so. You now know that the types of agents that cause infectious disease and the ways that infection occurs. Finally, you also know what countermeasures are used to fight infectious diseases at the individual and the community level. You now have the foundation of knowledge to move forward into further instruction aimed at informing you how we prepare and mitigate for, respond to, and recover from a pandemic event, very much like COVID-19. Please continue with the checks on learning that follow this lecture and consider the activity that I put in the module for you. I hope you've enjoyed this block of instruction. Now please consider for a moment our academic program in emergency management. Thank you.
Someday, in the not-so-distant future, it happens. The moment you realize you're ready for anything. Get a degree in emergency management from Jacksonville State University and be ready for where you're going.